Okay, I want you to stop whatever you're doing right now, because what I'm about to share with you in the next few minutes could literally save your life tonight. I'm not being dramatic. I'm not trying to scare you. I am a doctor, and I'm telling you as someone who has sat across from patients who've had strokes, who've had heart attacks, who've developed dangerous blood clots, and when I ask them about their sleep habits time and time again, I hear the same thing. They were sleeping the wrong way, and nobody ever told them. Nobody ever sat them down and said, hey, after 60, your body changes, and the position you sleep in is no longer just about comfort. It is about survival. So today, that changes. Today, I'm going to be that person for you. My name is Dr. Favor, and this channel is dedicated to helping you live longer, stronger, and healthier, especially in those years after 60, when your body starts speaking a different language and you have to know how to listen. If you're new here, welcome. Make sure you subscribe because I put out videos every week that your doctor probably doesn't have time to tell you in a 10-minute appointment. And if you've been here with me for a while, you already know. We don't do surface level here. We go deep, we go real, and we go practical. Now, let's talk about sleep, and I mean really talk about it, not the fluffy get 8 hours and drink chamomile tea version. I want to talk about the physical mechanics of what happens to your body when you lie down at night, because after 60, those mechanics matter in a way they simply didn't when you were 35. Your cardiovascular system changes, your blood vessels change, your circulation changes, the way your brain clears waste changes, and the direction your body is facing while all of this is happening. It matters more than most people realize. Let me start with something that shocked even some of my colleagues when the research first started coming out. Your brain has a waste clearance system. It's called the glymphatic system, and it is most active while you sleep. Think of it like a cleaning crew that comes in at night, flushes out toxins, clears out metabolic waste products, including the proteins associated with Alzheimer's disease and cognitive decline. This system does not work equally well in all sleep positions. Studies, real, published, peer-reviewed studies, have shown that sleeping on your side, specifically your left side or your right side rather than your back or your stomach, significantly improves glymphatic clearance. One study published in the Journal of Neuroscience found that the lateral position, that side sleeping, was the most efficient for waste removal from the brain. Now, why does this matter for stroke prevention? Because one of the contributors to strokes, particularly the type caused by blockages, is the buildup of plaques and inflammatory debris in the blood vessels of the brain. Better glymphatic clearance means less accumulation over time. That's not a small thing. That's years of protection night after night while you sleep. But let's go even further, because I want you to understand why the left side specifically gets so much attention when we talk about heart health after 60. When you lie on your left side, something remarkable happens to your cardiovascular system. Your heart, which sits slightly to the left in your chest, actually has more freedom of movement. The aorta, which is the largest artery in your body, the main highway that carries blood away from your heart to the rest of your body, sits to the left. When you sleep on your left side, you are essentially reducing the workload on your heart. Gravity works with you instead of against you. Blood flows more naturally toward the heart through the vena cava. That's the large vein that returns blood from the lower body back to the heart. And this means your heart doesn't have to work as hard to maintain circulation while you sleep. For someone over 60 whose heart may already be dealing with some degree of arterial stiffness, slightly elevated blood pressure, or the natural wear that comes with decades of pumping, this reduction in cardiac workload during sleep is genuinely meaningful. Now, let's talk about blood clots, because this is something that terrifies my patients, and rightfully so. Deep vein thrombosis, DVT, is the formation of a clot, usually in the deep veins of the legs, and after 60, your risk goes up. Your blood circulation slows slightly, your vein walls may have lost some elasticity, and if you're someone who sits for long periods during the day, your risk increases even further. When you sleep in certain positions, particularly flat on your back without any elevation or curled in ways that compress the major veins, you can restrict blood flow in ways that encourage clot formation. Sleeping on your left side with your legs slightly bent, perhaps with a pillow between your knees, keeps the inferior vena cava, the large vein on the right side of your spine, from being compressed by the weight of surrounding organs. Better venous return means blood is moving, not pooling. Moving blood does not clot, pooling blood does. This is not complicated physiology. It's the reason surgeons get patients up and walking as soon as possible after operations. Movement and circulation are your clot prevention tools, and even the position you sleep in at night is a form of that. Now, I want to address the people who sleep on their backs, because I know some of you are thinking, but Dr. Sarah, I've always slept on my back. It feels natural, it feels comfortable. And I hear you. Back sleeping, called the supine position, is actually recommended for some things. It's good for spinal alignment in certain people. It can reduce facial wrinkles. And for individuals with certain types of acid reflux, it can help if the head is elevated. But here's the problem after 60, and I want you to really hear this. Back sleeping significantly increases the risk of sleep apnea. Sleep apnea is a condition where your airway partially or fully collapses during sleep, causing you to stop breathing, sometimes dozens or even hundreds of times per night. And the connection between sleep apnea and cardiovascular disease is one of the most well-established relationships in all of sleep medicine. Sleep apnea raises blood pressure. It causes the heart to work harder. It creates surges of adrenaline in the middle of the night as your body desperately tries to restart your breathing. It promotes inflammation in the blood vessels, and it dramatically increases the risk of stroke, heart attack, and arrhythmia, particularly atrial fibrillation, which is itself a major stroke risk factor. When you sleep on your back, gravity pulls the tongue and soft tissues of the throat backward, narrowing the airway. Side sleeping keeps that airway open. It's one of the first things sleep specialists recommend to patients with sleep apnea, and for many people, it makes a dramatic difference. Let me tell you about a patient I'll call Margaret. She came to me at 67 complaining of fatigue, morning headaches, and what she described as waking up feeling like she hadn't slept at all. Her husband had mentioned she snored. Her blood pressure was creeping up despite medication. We did a sleep study and found she had moderate sleep apnea, and she had been sleeping on her back her entire life. We worked together to transition her to left side sleeping using a body pillow for support. Within 6 weeks, her husband reported the snoring was nearly gone. Within 3 months, her morning blood pressure readings had dropped. Within a year, she told me she felt like a different person. She hadn't needed any new medications. She had just changed the position of her body during sleep. I tell you this not to say that sleep position is a magic cure. It is not. But it is a powerful, free, zero side effect intervention that far too few people over 60 are using intentionally. Now, what about stomach sleeping? I'll keep this section brief, because honestly, if you're over 60, stomach sleeping is the position I most strongly want you to move away from. It compresses the chest, making breathing harder. It puts enormous strain on the cervical spine. That's your neck, and can contribute to nerve compression that causes tingling in the arms and hands. It restricts blood flow by pressing the abdominal blood vessels against the mattress. And because your head must be turned to one side to breathe, you're often maintaining a rotated neck position for hours, which can contribute to headaches and reduce circulation in the vertebral arteries. Arteries that supply blood to the back of the brain, which is involved in a particular type of stroke called a posterior circulation stroke. I'm not saying one night of stomach sleeping will cause a stroke, but night after night, year after year, compounding on an already aging vascular system, that's a risk that simply isn't worth taking when the solution is as simple as learning to sleep on your side. Now, I know what some of you are thinking. Dr. Sarah, I don't choose how I sleep. I fall asleep one way, and I wake up in a completely different position. And this is absolutely true for many people. You can't consciously control your body once you're deeply asleep. But what you can do, and what sleep specialists and physiotherapists have been recommending for years, is set up your sleep environment to make side sleeping the path of least resistance. Here's what I recommend to my patients who are making this transition. First, use a body pillow. A long body pillow along your front gives your top arm and leg somewhere to rest, preventing you from rolling forward onto your stomach or backward onto your back. It also keeps your spine in better alignment by preventing your top hip from dropping forward. Second, try the tennis ball trick. It's old school, but it works. Put a tennis ball or a firm pillow tucked into the back of your sleep shirt. When you roll onto your back during sleep, the discomfort of the ball against your back will cause you to unconsciously roll back to your side. Third, consider the pillow between the knees. If you're a side sleeper and you wake up with hip or lower back pain, a pillow between your knees keeps your pelvis in a neutral position and makes side sleeping far more comfortable long term. And fourth, think about your main pillow height. When you sleep on your side, you need a thicker, firmer pillow to fill the space between your shoulder and your head to keep your cervical spine, your neck, in a neutral, straight alignment. A pillow that's too flat lets your head drop down toward the mattress, causing strain and reducing the benefit of the whole position. I also want to talk about one thing that doesn't get nearly enough attention when we discuss sleep positions and cardiovascular health after 60, and that's the vagus nerve. The vagus nerve is the longest nerve in the body. It runs from your brain stem all the way down through your neck, chest, and abdomen, and it is the master regulator of your parasympathetic nervous system, the rest and digest system that calms your heart rate, lowers blood pressure, and reduces inflammation. When you sleep on your left side, research suggests that the vagus nerve may be stimulated more effectively, promoting a deeper parasympathetic state during sleep. This is associated with lower overnight heart rate variability in a beneficial way, meaning your heart rhythm is more stable and regulated. Stable heart rhythm during sleep is protective against arrhythmias. And for anyone over 60, particularly those who have any history of palpitations, high blood pressure, or cardiovascular concerns, this is worth paying attention to. And while we're talking about the left side, I want to address something that sometimes causes confusion. Some people with certain heart conditions, particularly heart failure, have been told that right side sleeping or back sleeping is more comfortable for them because left side sleeping causes discomfort or palpitations. If you have been told this by your own cardiologist, please follow your doctor's specific advice for your specific condition. What I'm sharing today is general guidance for the broader population of adults over 60 without specific cardiac diagnoses that alter these recommendations. Your individual medical history matters, and nothing I say here replaces a conversation with your personal physician. What I am doing today is giving you the information and the language to have that conversation. To go to your doctor and say, "I heard about left side sleeping for cardiovascular health. Is this appropriate for me?" That is powerful. That is you advocating for yourself. Let me also mention one more thing that ties all of this together, and it's the importance of sleep quality overall after 60. We know that poor sleep duration and poor sleep quality are independently associated with higher risk of cardiovascular events. We know that people who consistently get less than 6 hours of sleep have significantly higher rates of hypertension, diabetes, obesity, and stroke. We know that the overnight period is when your body repairs blood vessel walls, regulates hormones like cortisol and growth hormone, and consolidates the immune activity that protects you from inflammation. Every single tool that helps you sleep better, including sleeping in the right position, is a tool that reduces your cardiovascular risk. These things compound. A body pillow costs $20. A pillow between your knees costs nothing if you already have a spare pillow. And the potential return on that investment is years of better heart health, better brain health, and a dramatically lower risk of waking up one day unable to speak, unable to move, or not waking up at all. I realize that sounds stark, but I'm a doctor, and I believe in telling you the truth. The small things matter. The habits you repeat every single night for the next 20 years of your life matter. And if changing the side you sleep on is one of those habits, if it is one piece of a larger picture of taking care of your body after 60, then it is absolutely worth doing. So, let me give you your action steps from today. Tonight, try sleeping on your left side. If you can't make it through the whole night, that's okay. Even a portion of the night counts. Grab a pillow and place it between your knees. If you have a long body pillow, use it along your front. If you tend to roll to your back, try the tennis ball method. And if you snore, if you wake up tired, if you have morning headaches, please talk to your doctor about a sleep study because sleep apnea is silent, it is common, and it is treatable. That's it for today. If this video helped you, please give it a thumbs up. It genuinely helps this channel reach more people who need this information. Share it with someone you love who is over 60 because this is the kind of thing most people don't know and nobody is talking about enough. And if you want to go deeper on heart health, brain health, and living well after 60, subscribe and hit the bell so you don't miss what's coming next. I'll see you in the next video. Take care of yourself because you deserve to be here for a long, long time.